Hi, everybody. Thank you so much for joining us today. This is the first webinar in the POPLAR Network Lunch and Learn webinars series on EDIIA in research. And today's presentation is on embedding equity in leadership and teams. Just going to advance my slide here. So as many of you know, EDIIA stands for Equity, Diversity, Inclusion, Indigeneity, and Accessibility. For advancement and quality improvement in primary healthcare to be done equitably, research and practice-based learning must be grounded in EDIIA principles. The POPLAR Network, which is Ontario's primary care learning and research network, is committed to advancing equitable primary healthcare delivery and health outcomes for everyone in Ontario. They've launched this webinar series to support that vision by building capacity for EDIIA-oriented research in primary care. The Alliance for Healthier Communities is pleased to be hosting these webinars on POPLAR's behalf. For those who are unfamiliar, the Alliance is a membership association for community-based primary healthcare organizations in Ontario, and all of our members belong to the EPIC Practice-Based Learning Network, one of 7 such networks that together make up POPLAR. POPLAR, in turn, is a member of the Canadian Primary Care Sentinel and Surveillance Network, or CIPSEN, which includes primary care learning and research networks from across the country. Today's webinar is about the role of leaders in building a culture that supports EDIIA principles. Dr. Nicole Kanicki, Director of Diversity, Equity, and Inclusion in Research and Innovation at the University of Toronto, will share her experiences and how her organization is approaching EDIIA into the future. Before we hear from Nicole, we'll have a few words from Cliff Ledwis. He is going to speak to us about his experience and put in a bit of a plug for some equity in leadership training from the Alliance. First, we'll cover some housekeeping and then start things off in a good way by acknowledging the original stewards of the land we're using today. So a few housekeeping notes. This webinar is being recorded, and we'll share a link to the recording along with the slide deck later this afternoon or tomorrow morning. So watch your email for that. There will be a Q&A and discussion period at the end, so please submit your questions in the chat panel. Feel free to start typing those at any time as soon as you think of them. We'll ask them on your behalf and do our best to group them thematically. If you'd prefer to ask your question out loud, please use the raise hand function and we'll unmute you when we call on you. Please remember to mute yourself afterwards so we can keep background noise to a minimum. Now, before we start the presentations, let's acknowledge our presence on Indigenous land. We recognize that the work of the Alliance for Healthier Communities, our members, and the POPLAR Network takes place across what is now called Ontario, on traditional territories of Indigenous peoples. They have lived here since time immemorial and have deep connections to these lands. We further acknowledge that Ontario is covered by 46 treaties, agreements, and land purchases, as well as unceded territories. We are grateful for the opportunity to live, meet, and work on this territory. Ontario continues to be home to vibrant, diverse Indigenous communities who have distinct and specific histories, needs, and assets, as well as constitutionally protected and treaty rights. We honor this diversity and respect the knowledge, leadership, and governance frameworks within Indigenous communities. In recognition of this, we commit to building allyship relationships with First Nation, Inuit, and Métis people in order to enhance our knowledge and appreciation of the many histories and voices within Ontario. We also commit to sharing and upholding our responsibilities to all who now live on these lands, to the land itself, and to the resources that make our lives possible. My name is Catherine McDonald, and I'm a settler here on these lands. I live and work on the traditional lands of the Anishinaabe, the Wendat, and the Anishinaabe, the Wendat, and the Haudenosaunee peoples, and in what is now called Toronto. I do invite you to enter your own land acknowledgements in the chat. And now I'll introduce our speakers. Today's keynote speaker, Dr. Nicole Kanicki, is the Director of Equity, Diversity, and Inclusion in Research and Innovation at the University of Toronto. In her role, she examines, advocates, and advances EDI in all aspects of UT research, innovation, and entrepreneurship. Dr. Kanicki is the former special advisor on anti-racism to the president of Western University and has over 7 years of experience in research administration and EDI roles in academia. She has a passion for social justice and uses an anti-racism and decolonization framework in her EDI work. First, we'll hear a few words from Cliff Ledwis, the clinical lead and associate executive director of Access Alliance Multicultural Health and Community Services. In this role, and in his many leadership roles at the Alliance, he has a lot of experience in equity-oriented leadership. He's also the chair of our Member Engagement Committee, which has just finished producing a training program called Governing for Health Equity, which may be helpful for many of you to use on your EDIIA journeys. And he'll say a few words about that. Cliff, over to you.
Sure, great. Thanks, Catherine. So I just wanted to say a quick welcome and thank you to everybody for taking part in the first of the 4 webinars that the Alliance is going to be presenting to you. Catherine has already mentioned POPLAR's vision about advancing equitable primary care delivery and health outcomes for everyone in Ontario. We know that POPLAR puts a lot of emphasis on leadership, research, data collection, knowledge mobilization, knowledge translation as a means to be able to advance health equity. Most of you will also know that there will be 4 keynote speakers who are all thought and action leaders in this work, taking part in this series. And today, we have the privilege of being able to hear from Dr. Nicole Kanicki. So Nicole, welcome to you and thank you for taking part. I want to also take a minute just to point out some of the work, the package of work that involves EDIIA that the Alliance has been and continues to provide and to lead. Certainly there is an important report implementing health equity for change that the Alliance has done recently that is available on the website. And I would encourage all of you to check out that report, read through it, lots of important information in that report. Catherine has also mentioned the Governing for Health Equity training that I was involved in, and that training is particularly important. And I just want to mention to you that all of us are leaders. Regardless of the role that we hold, all of us are leaders. All of us have a role to play. All of us have a contribution to make when it comes to EDIIA. Within your agency, you may have a particular role. You may be a senior leader. And from a quality improvement perspective, it is particularly important that senior leaders are always advancing this work, that they are always talking about this work, that they are always encouraging and expecting action around this work. As a senior leader in your organization or as an aspiring senior leader in your organization, it is critical that you play a role and a visible role in demonstrating and showing how important this work is within the context of our agencies, our communities, the systemically vulnerable populations that we are here to support. It is up to us to be able to advance and take action on making change. The Governing for Health Equity training is an important training that you can take part in as a senior leader and that your organization's board of directors can take part in. There are 4 modules in that series. They are excellent modules, and I would encourage all of you to take part and encourage your board of directors to take part. I also want to mention the Health Equity Indicators Project that the Alliance was heavily involved in, and that Access Alliance, the agency that I work at, led that project. Particularly important on building capacity for equity-informed planning and evaluation within your agency. 6 CHCs joined Access Alliance as champions across the province for this work. The report is available on the website. And again, I would encourage you to check that out. So that's my plug in terms of, the work that the Alliance has done. And again, to emphasize how important it is for you to take an active role, and particularly if you are a senior leader, you must always keep this work at the top of your agenda, move it forward. It is something that you must demand in your role and in your agency. Okay, Catherine, back over to you.
Thank you so much for that introduction, Cliff. And I will turn you directly over to Nicole. So thanks again, Nicole, for taking the time to speak with us today.
Thank you. Thank you so much. And it's such a pleasure and an honor to be here today with you all and share this space. I really want to re-emphasize what Cliff has said, because my presentation to you today is really based on a lot of this, which is the importance of leadership, and just exactly as Cliff has emphasized, that it's not about the title or the role you specifically have that makes you a leader, but everyone can be a leader in this environment, and regardless of title and role that you play in the space where you are at. So I really hope that I'm able to really kind of bolster that message here as well as I provide this presentation to you. And thank you too for the generous introduction. So I will tell you just a little bit, I guess, additional about myself as I go into this. I love providing just my own positionality for you to understand who I am, how I come to this work, and the lens that I bring to the work, because I'm about to tell you how important it is, the lens that you bring and who you are to this work specifically. So Nicole Kinikima, I was born and raised in Cape Town, South Africa. I grew up there. I grew up through apartheid and kind of was there during the transition as well into early adulthood. And then I moved to the US. I lived in the South in Tennessee for about 8 years and did my undergrad there before moving up to Canada. So I've been in Canada now for 13 years. And so, my journey, my experiences and everything that, my education and my lived experiences all contribute to this work that I do on a daily basis. So you will hear and see as well in the presentation today, I'll give you a lot of practical examples, and those examples are really sort of from my lived experiences and things that I've lived through and experienced as being in sort of academia, being within research and within research spaces, and where I've seen the issues of equity, diversity, and inclusion really impact the individuals from underrepresented groups in these spaces. And, in developing best practices, we really need to understand what those experiences are. And a lot of even beginning to understand those lived experiences also comes with examining who we are and how we see these individuals within our environments, especially if we don't self-identify as from these groups in this way. So I'm going to share my screen now and begin the presentation. There we go. I think you should be able to see that. So I usually kind of enter this space, and a lot of the times too, I know I sometimes have it more interactive, and I don't think we have access to the chat, or that anyone can kind of write into the chat. But one of the questions I always like to ask people to start off with was, where were you in these dates? So 1983 specifically. So if you just, wherever you are at right now, just reflect on what point or where were you in your life in 1983? Just kind of think about that. I'm going to give you my sort of where I was at. So 1983, I was a 3-year-old toddler, like I said, growing up in South Africa. Yeah, so that was me in 1983. So kind of think about it. What were you doing? What point in your life were you at? Were you somewhere specifically? Were you going, going through education? Were you working already? Were you, some people may not have been born in 1983 yet. That's okay. But just kind of thinking about 1983. The next date I want you to reflect on right now, as you're listening, is 1996. Where were you at in 1996, or what were you doing in 1996? So for me personally, 1996 was a year where I was a 16-year-old teenager, again in South Africa. Actually, South Africa was really kind of going through its transition, it had left apartheid behind about 2 years before 1996 and 1994, 93-ish. And so really living sort of in a newer country and experiencing that from the perspective of a 16-year-old teenager. Now, the reason why I like putting these dates here and having people reflect on what were you doing in 1983 and what were you doing in 1996 is that a lot of Canadians don't know that 1983 was when the last Black segregated school closed in Nova Scotia. 1996, as many of you know, and especially over the past sort of 2 years or so, is that many of us have kind of found out only very recently that 1996 was when the last residential school closed in Canada. Now, when you put that into perspective, for me personally, I was alive at both of these times. I was living in a segregated country where people were being oppressed, and can actually in 1983, Canada still had imposed sanctions on my country for its apartheid laws, yet there were kids like me living in segregation right here in Canada as well. Again, 1996, with the residential schools still being fully operating, you understand as well that the ideologies and the systems and structures that upheld such institutions didn't just go away. They didn't just disappear overnight. I like to say we never had Men in Black come. If you've watched the movies Men in Black, where, there's alien activity and then the Men in Black come and they clean up the alien activity and they use this little flasher called a neuralizer where they flash everyone and all the humans in the room forget all of the alien activity that happened and they kind of just carry on with their lives. We didn't have that in Canada or anywhere in the world when, systems of oppression and systems of colonization or segregation ended, right? These ideologies definitely are still very present in our society today. The reality is too that, the world and the systems that we live in, systems of hierarchies have existed way before colonization even came into being, right? In the world before 1500, the concept of hierarchies was a very common principle. Children belonging to parents, parishioners to churches, kings and queens and peasants in this way, right? Now, as the exploration of foreign lands and the desire for colonization and conquest became the pursuit of European society, dominance and the hierarchy of others, such as savage Indians and subhuman Africans, formalized into racial hierarchies as well. Researchers and scientists then began to further develop these ideologies of racial superiority of whiteness and the inferiority of individuals as skin tones darkened, using flawed methodologies steeped in bias and colonial frameworks of white supremacy. At the same time as well, acceptance into society also relied heavily on an individual's gender, their ability, and conformity to heterosexual expectations of gender roles and expressions. Women's role as homekeeper and childbearer in society created expectations of their contributions being only limited to these spaces. And then when they, did break these gender norms, they were ostracized and continually kept from full participation. People with disabilities were treated as burdens to society, and the harms and structural violence done to them as they fought for their right to citizenship in society was hindered by resistance to acknowledge them as citizens in our society. And then for those, like I said, who did not conform to heteronormative gender identities, expressions, and sexual orientation, they were treated as second-class citizens and denied their right to participate in society because, through legal and policy means. I like to remind people that even in Canada as well, same-sex marriage was only legalized in 2005. That is a very, very recent. Now, this information often was backed by bias and discriminatory research, developed in our academic structures and within the research spaces, and went into popular thought and culture, and they served to dehumanize Black, Indigenous, people of color, people with disabilities, the LGBTQ plus communities, and oftentimes women as well in all aspects of our society. Now, we are all products of our environment. The individual ideologies we carry into our educational and research spaces and healthcare spaces and places of work, and the culture we built there is significantly influenced by the way in which we are raised, the people we surround ourselves with, and the social systems and structures we are exposed to. Our ways of knowing and understanding the world is then also influenced by these nurtured influences, which follows that the way in which we relate to the people in our research, in our academic and healthcare settings and environments and lived spaces are affected by these. The social systems and structures of our Canadian context and most of the world have been shaped by decades of social development, steeped in social hierarchies. Now, some of these are expressed here in this diagram, which shows an inside circle of characteristics that are seen to be more favorable or desired than those on the outside. In our society, we treat each other and relate to each other, whether consciously or unconsciously, on how we fit into the inside or the outside of the circle. The more you are on the inside, the more likely you are to be treated well, get a job, be paid more, be mentored, receive professional development opportunities, be promoted, and so on. The characteristics and identities of the inside circle, again, too, have oftentimes been deemed more desirable on hierarchies of intelligence and work ethic. Now, this is because of colonial foundations of knowledge development, research, and pursuit of truth and human understanding steeped in historical social inequities that created racism, sexism, homophobia, ableism, ageism, and other oppressive ideologies. And our Canadian society is no different in that they exist within the fabric of our academic and research environments. Now, privilege is what an individual holds when they're a member of some of the characteristics of the inside circle, and different degrees of power afforded them when they're able to access opportunities in these spaces because of that privilege. It is not the possession of that power and privilege that is a bad thing. It is the way in which that power is used over others that makes it harmful. Now, this is very foundational to much of what we're about to discuss, and I'd like you to kind of keep this in mind as we go through this presentation too. Many of you are familiar with bias. Just to define it again, bias is prejudice in favor of or against one thing, person, or group compared with another. So it's usually in a way considered to be unfair, right? Unconscious bias refers to the influence of implicit or unconscious assumptions in the assessment of individuals. Now, schema is this concept. It's a categorical assessment of individuals and relationships between individuals. This concept explains the way in which we categorize our environment. As you know, when you walk into a room, you're assessing the room. The people who approach you, you're putting them into boxes so that either maybe you can need to remember them or you need to know what you need to talk to them about. But you also categorize people in other ways, such as, are they Black? Are they white? Are they abled? Are they disabled? Are they threatening? Are they safe? Do you want to avoid them? Are you attracted to them? Do you think they're smart? Do you think they're not smart? Do you think they're competent? Do you think they're not competent? And so on. Now, when the reality of schema is combined with bias, especially that based on identity and characteristics of equity, inequity and exclusion is a result. Now, these biases, especially unconscious bias, these biases are byproduct of our environment and culture and are held even by people with strong commitments to fairness and diversity. I myself personally have to be very aware of the biases that I may hold. I'm only limited to my own experience. Even considered an EDI expert, on a daily basis, I may do harm. And so I really have to understand that the biases that I may hold may impact people, and I have to be aware of them. People may also hold biases against members of groups to which they belong. For example, we've seen this happen, especially, now sort of these days we talk about having, diverse panels, especially when you're sort of in the hiring process. Yet even women, when they are sort of put in those positions to evaluate candidates for leadership roles, because we've been socially normalized to understand the perfect image of a leader, or the person that is the perfect fit to be a leader is a white man. Oftentimes we will disregard a big CV, a lot of experience in a woman, because we have this image of the perfect CEO or the perfect senior leader has to be a white man. And so in this way, even individuals who are from equity deserving groups may impose this sort of socialized and normalized way of thinking of superiority in these spaces. So just to touch on a couple of the biases that I oftentimes see happen in these spaces as well, right? Stereotypes and expectation. We know and understand what these are. These are characteristics put on whole groups of people where they are expected to either behave in this way based on group identity, right? It really limits people within these environments when there are assumptions made about them based on their identity or a group that they belong to. Affinity bias is this bias whereby we have a tendency to want to surround ourselves with and be with people who either look like us or culturally reflect us. This is oftentimes what I see as a result of those homogenous labs or homogenous work environments where everybody looks the same. No one's really looked around to see and realize that we've really just surrounded ourselves with people who look just like us. Confirmation bias is this bias whereby we believe something to be true and we only seek information that confirms that belief, and we reject any information that contradicts what we already believe, whether that be about people, about situations, or about something within the workplace or work environment as well in this way. Benefit of the doubt. Certain people with certain identities tend to get the benefit of the doubt more so than others do, right? So for example, again, too, within research spaces, I talk about, labs, in a lab, say, if a female trainee messes up on a experiment, oh my goodness, you know what? That just proves she's not meant to be a scientist. She's not meant to be in this lab. This is just not work for her. Whereas if a male scientist, a male trainee does the exact same thing, it's like, oh no, that was just one mistake. He's got such great potential and he's going to be so good in this field, in this area. That was just one slip up. So some people are given the benefit of the doubt over others, oftentimes also based on group identity. Prove it again. We oftentimes hear this, especially from individuals from underrepresented groups. I have to work 5 times as hard, 10 times as hard as my colleagues from dominant groups to even prove my value and my worth. Oftentimes I talk about this concept, and I'll talk about this a little bit here too. Individuals, especially from underrepresented groups, feel visibly invisible. They don't get celebrated when they do something really, really good, but people have a tendency to ignore them. I oftentimes see this again too, even when talking to groups and working and consulting with groups on when they're trying to think about diversity in their teams or diversity in the workplace or diversity in leadership. And they've had people in their organization from underrepresented groups working there for so long, yet they haven't considered that individual for a leadership role. Even that individual, oftentimes I hear from those individuals as well, where they say, I've trained people who have come in after me and I have so much more experience than they do, but I trained them and then they end up becoming my senior leader, right? We oftentimes see this again. They have to prove themselves over and over and over again. Now, just to summarize what I've just shared with you as well, right? We have to understand that history impacts our current society. And our current society is impacted and shaped by these hierarchies and these systems that we know have influenced and have not disappeared overnight. They still exist. And so we express these through the biases that we hold in our workplaces and toward individuals from underrepresented groups within our spaces. This oftentimes, and these biases expressed, lead to the inequities we see. It leads to the qualitative stories we hear of individuals within these spaces, of patients we hear who, express their, who are from underrepresented groups, who express their experiences within healthcare and within healthcare systems as well. And the reality is that this is also, it impacts the leadership lens that we take on within our decision-making, within how we lead our teams and how we actually impact and influence our environments that we find ourselves in. So what is equity, diversity, and inclusion? Like I said, my title and my role at U of T is the Director of Equity, Diversity, and Inclusion in Research and Innovation. I oftentimes get from people, what is it that you do? So, I'm gonna, I never also assume that people know exactly what the definitions of each of these terms are. So we're gonna work through just exactly what they are before we find out how to actually implement them into the spaces that we are at. So, in order to understand what equity is, I'm going to kind of bring 2 more terms that are very commonly found as well in these spaces. Now, equality means that each individual or group of people are given the same resources or opportunities to succeed. I just explained to you that within our academic structures, within our healthcare systems, within our society as a whole, we do not live in an equal society. There are people who are privileged and there are people who are not privileged. And oftentimes too, there are people who are advantaged and disadvantaged, not because they're not good enough, but simply because the systems and structures and the way that we think about them as being at a deficit. So our systems and our structures, our academic systems and our academic structures, our healthcare systems and our healthcare structures are bent. They are not straight. So that not everyone actually accesses these structures and these systems in an equitable way, right? So if we said to everyone, which is basically what we do in our society today, we are all equal, but yet the systems and structures are bent in a way that allows certain people to get the apples easier than others, then, the understanding is that we know we're not fixing things. Our systems and our structures will continue to go on with inequity as it is. So this is why within the work that I do, I work within a framework of equity. We acknowledge and admit and understand that our systems and structures are bent. They are broken. They are broken in a way that advantages some and disadvantages others. So right now we're working with a broken system. So the strategies that I use need to ensure that it provides those who are in our systems who are disadvantaged with the opportunity to be able to access these systems in a way that the others can as well. And that means being intentional in our strategies to supporting them. So equity specifically is a promotion of fairness and justice for each individual by providing everyone with tailored necessary resources to overcome individual barriers that are a result of systemic forms of oppression. So this is what we talk about when we talk about, within these, again, to a lot of the spaces that I'm in, when we talk about targeted hires, we know that the hiring system and the hiring processes are broken, right? There are biases that exist within it. A lot of these processes are so subjective as well. So that we talk about, like I said, you can disregard an individual who has more experience, a bigger CV, simply by saying that, but this individual is just a better fit for the environment. What is fit? What does that mean? How do we measure it? We can't, but yet individuals are oftentimes hired on that. And this is how individuals from underrepresented groups are disregarded, undervalued, and not hired in this way, and why we see the lack of diversity oftentimes too, right? So we would love to get to justice. Justice is a collective responsibility to create a free and just society to ensure that civil and human rights are preserved and protected for each individual. But that means we got to fix the tree first. We got to fix our systems. We got to fix our structures that are disadvantaging some and advantaging others. And this is why we do the work of equity. Now, inclusion, I'm sure you're very familiar with a lot of these concepts as well. We know what exclusion is, right? Where people are completely kept out of participation. Segregation essentially is, what I lived through in apartheid. We live here and you live there. You get this little here and we'll take what we want here to do what we need to do, but it's separate, right? We are, I believe, especially in academia, especially within research sort of environments, the work of research in the space between integration and inclusion. Integration is essentially where, underrepresented folks are there, but they don't actually get to participate. Right? They're around, but we don't actually, it's what we don't see them in leadership roles. We don't see them leading teams or, being promoted and so on. Integration essentially is, as someone liked to describe it to me, it's being invited to the party, but you don't get to dance. People in these environments, they don't feel a sense of belonging. Again, we've heard, especially over the past, 2 years, all of the working groups, I'm sure in your workspaces and where you're at, anti-racism working groups or EDI working groups, and, the stories of people who are within these environments, who are from these underrepresented groups saying, I've never felt like I've belonged. I've never felt like this is a space that includes me or that values me in this way. And this is what we talk about with integration. We hope to get to inclusion, where everyone who is there has an opportunity to fully participate and fully belong, regardless of their identity, their background, their disability status in these aspects, right? Now, the concept of diversity is one commonly used. In my practice, I like seeing diversity as a result of an equitable and inclusive environment. I see diversity oftentimes as well as counting heads, right? It's the numbers, right? But the numbers don't always tell us the full story. It doesn't tell us if people feel included. It doesn't tell us if people are being treated equitably in this way as well. But it is a way that we can oftentimes measure or reflect on, or over time, reflect on how well we are doing for inclusion and equity. But really, it shouldn't be the be all and end all. And I find that it really has sort of become this and kind of has been used in this way. And this is too where we talk about tokenism as well, right? It's used within this framework of diversity. So reflecting on the fact that, diversity is about the lived experiences, identities of individuals within the environment that contributes to better research as well. I know, I don't have to make this case for the importance of diversity. I'm sure you're familiar with the research that shows that diverse teams tend to have greater impact. Their work tends to be more generalizable. We live in a globally diverse world. If we have more homogeneous thinking in the way that we do the work, and homogeneous ways of being and understanding included within the decision-making processes that we undertake, of course, it's not going to be generalizable to a globally diverse world and a multicultural Canada that we sort of pride ourselves to be in as well. So the importance of diversity, I think, is there. We understand it. We just need to ensure that we're being intentional about it. One thing we also have to remember is that EDI is an issue of structure. It requires a structural approach. We need to do things like educate on an individual level and basis, but we also need to change our organization. We need to be intentional about the way that we do our processes. Again, like I said, the way we make our decisions, how intentional we are about creating inclusive and equitable environments where we are at, because that impacts our research, and our research impacts our society. I just wanted to put this slide here as well. I'm not going to spend too much time on it, but to give you an idea of the frameworks that I use in thinking about EDI in research and innovation. So the way that I see EDI in research and innovation really takes on two approaches. You have to look at the research environment, so the environment within which research is taking place, and the aspects of those that impact the research, and then thinking about the research process. So thinking about, things like your research question, your methods, your analysis, your results interpretation, your knowledge mobilization, and the impact that it's having as well. So what I'm really going to kind of go through more so is talking about the research environment, which really talks to your teams, the leadership, and the aspect of, how you lead for equity within these spaces. Leaders and leading for equity really is about equipping leaders with the knowledge and the understanding of what inequities are, what exclusion is, and the importance of diversity. Right? It's about equipping them in that way. It's about also having the courage to do the right thing. EDI work is not easy. It is the road less traveled. We are here in 2022 after a racial reckoning. It took a man dying, being murdered in front of our eyes on camera, George Floyd, for us to be able to start to even be able to have these discussions. 2 years ago in my space and in the work that I've been doing, I had to maneuver around and find alternative language to use to get people to understand equity, diversity, and inclusion. I'm sorry, I don't know why I just went. But, fortunately we're here now, but it took a global racial reckoning for us to even be able to have a conversation like this right now. So understand, it takes courage to start to do this work, but it also takes tools. It takes money, it takes power, and it takes effort from organizations and individuals to do this work. So I just want to talk about, in your research process, a couple of questions that I want to leave you with when you're thinking about how you're doing research for equity in this way, right? Think about what assumptions are you making about underrepresented groups in your research question, and how is the literature contributing to this? Because it's a very shaping or asking of your research question, especially when you're talking about things like, or you're bringing in aspects of people's identities like race, sexual orientation, gender, disability status, that can perpetuate those harms, right? And that if your very research question is perpetuating harm, your methodologies will perpetuate harm, and the results of your research and the outcomes will perpetuate historical harms as well. Also think about how you're including underrepresented groups in your study populations, right? Context matters. What aspects of people's identities are you including or are you excluding? Are you not considering may impact the way in which your work will then be used, right? Again, does your data analysis approach make assumptions about underrepresented groups? And what assumptions are they? Are those assumptions racist, sexist, homophobic, ableist in any way, right? And does it frame the individuals from underrepresented groups in a deficit way? Does the reporting of your results, again, too, perpetuate marginalization? Does it bring about inaccurate assumptions of individuals? And then will individuals from underrepresented groups be able to access the outcomes and the results of your work? And will it be generalizable to a diverse population? Now, thinking about EDI in teams and leadership best practices, it is about creating an inclusive environment, right? We need to normalize discussions on EDI issues. Discussions like this that we are in right now are important, and we need to continue these as well. Because when we start to normalize the language, speaking about it, and breaking down the issues as well, we start to educate people and also equip those in our environments with the language and the knowledge to be able to do no harm. Now, being intentional as well about making things like meetings, events, and initiatives diverse, accessible, and inclusive. Thinking again too, I know, when you're sort of creating initiatives or meetings or events, you're so busy in the rush of what you're doing, you're not thinking about how accessible is this? If an individual has a disability, will they be able to attend this meeting? Or, even thinking about it in this aspect, I always talk about, best practices for meetings as well, making sure that your meetings are between 9:30 and 3 p.m. Why? Because individuals with small children may need to go and get their kids from school or daycare or childcare, or they may be caring for someone at home as well, an elderly parent as well. So thinking about the ways in which you make what you are doing accessible and inclusive for individuals, regardless of, again, their identity. Even things as simple as, don't have a potluck during Ramadan. Do you know when the month of Ramadan is, right? Do you know when Yom Kippur is? Don't have a big meeting or a big event during that time. Be considerate about it as well. Again, the little things make a big difference in creating an inclusive environment as well. Doing things like land acknowledgements as well at the beginning, right? And using it as teaching moments for people about learning about the land and about Indigenous peoples in Canada as well in this way. Pronouns. Right? Using pronouns when you're doing meetings is a way as well to be more inclusive. Again, being intentional about the diversity of your teams. It's imperative to, diversity is imperative to good governance and work. We, again, too, in this space and in many aspects of medical sciences, we've kind of really realized as well, I'm sure many of you are familiar with the issue of the pulse oximeter right now. Right? Pulse oximeters are less valid and reliable for individuals as skin tones darken. The way I look at it from a research perspective, I ask, who created something that wouldn't consider the skin tones of different individuals when you know that this thing has to read important things like O2 levels and heart rate through skin with different types of melanin? Obviously, the research team that developed that, the peer review process that they went through, nobody stopped to ask, how diverse is the population that we tested on? Or there wasn't anyone on the research team that said, oh, you know what? Let me check and make sure, I've got darkest skin tone. Let me check this pulse oximeter that we're developing and creating. And let me make sure as well that, compared to my colleagues who are maybe white, does it work the same for me as it does for them? Obviously, that was a homogenous team that created it, homogenous peer review process it went through that only considered individuals who were white. And that's sort of the perspective that they took and the lens that they took. This example is a perfect example of how important it is for us to understand that we are creating and developing things within our healthcare processes and healthcare systems that are for a globally diverse world. Do you consider this when you have a research team? Because the more diverse your research team is, the more you will actually have those perspectives as well. I see this oftentimes where, again, I work with a lot of research teams where we're building and, when I ask about, so what's the diversity of the research team? And they're like, you know what, we don't have many diverse people in this research field, in this research area. I was working with a group that was looking to build a research team for a project on mental health. And I was like, okay, so what's the diversity of your team? Because, individuals who, who self-identify from to us LGBTQ plus communities, they have high rates of suicide. So making sure that you have that perspective and that lens on your work is going to be important. Also, racialized individuals, like having that racialized perspectives as well, supporting mental health for, Black individuals and Indigenous individuals. And, the response I got was, oh, our field, of experts is not very diverse. I go on Twitter. One of the first things I find is a queer Black researcher at the institution working in that space, doing work on mental health. It was that simple for me to just go on Twitter and find an individual at the institution who could work on this research team that could contribute in this way. And this is what I talk about with research teams. Oftentimes individuals from underrepresented groups are visibly invisible. They are experts within their field and they are there, but it's like, they're just not seen. We need to also understand how we contribute to the diversity of our trainee recruitment, hiring, mentorship, and sponsorship processes, right? This is also aspects of building EDI capacity. So building diversity within our, body of experts, but also ensuring opportunities for those individuals that are not based on being part of majority groups, being part of privileged groups, but that we understand as well that it is not an individual's, being part of the dominant group, or coming from high socioeconomic status environments that qualifies them or that will make them a good doctor one day. We know that those two don't correlate, right? It is about an individual's inert abilities that makes them good for a job or good enough to be able to do this work. So understanding that just because an individual had to work in their summers at McDonald's to support their families, does not mean that they will not make a good doctor one day, because someone comes from a highly privileged home where they could volunteer, or they had these opportunities to work in research with, high level physicians because, their mom or dad or uncle was able to get them those positions during their summers, right? So understanding as well, what do we value in our trainees, and understanding that things like privilege oftentimes is a barrier in this way. Mentorship and sponsorship opportunities as well. Who are you mentoring? Who are you sponsoring? And again, too, think about affinity bias. If you self-identify from a dominant group, you're more likely to actually sponsor and mentor students or trainees who look like you. Asking yourself about how you are contributing to EDI, in whom you're mentoring, and the diversity of those you are mentoring and sponsoring for another opportunity. If you see an individual who's from an equity deserving group or an underrepresented group, and they are really good at what they do, put them in front of a leader. Give them an opportunity in a way. Give them that next job and that next career opportunity. Use your position of power and privilege to amplify that voice over there. Again, EDI education and training, what we're doing right here is really important and critical to understanding, leadership and creating inclusive teams. EDI metrics, what gets measured gets done. Be very cautious too about how we measure EDI. Again, like I said, diversity and the numbers can become very tokenistic, but I've also seen how EDI metrics has been weaponized to both, advance, but also fight against sort of the advancement of EDI in many aspects, right? So, people, they're like, we can't do EDI without the numbers. But then when you want to collect the numbers, they're like, no, we don't have the resources. We can't actually collect the numbers, or we can't really reflect on how equitable the environment actually is, right? Because they don't actually want to have to be able to take action. So people want that, they use it as a way to say, we can't do EDI because we need the numbers. But then in order to take action, they're like, no, those numbers aren't good, or, the way that we're collecting it, or we can't collect it anyway. So we actually can't take action. So be very aware of how EDI metrics are used to weaponize in this way. Again, collecting demographic information is becoming a big thing now. We're seeing it everywhere. I know even at U of T, we're really strategizing on the best ways to be able to measure EDI in this way. So, we're sort of attaching demographic data collection processes to everything, our programs, our initiatives, to our research itself, collecting it from patients and so on. And it's great. I think it's great because, like I said, what gets measured gets done, right? But at the same time, make sure that you're not perpetuating harm in the way that you're collecting this information. So, some of the last, I just have 2 more slides to kind of leave you here with, but being a transformative leadership, I want to encourage you here as well, is really about knowing ourselves and reflecting on our complex and intersectional identities. Who you are and how you come to this work impacts the way you do your work. So your biases, your identity, the limitations of your own lived experiences to not even be able to understand those from underrepresented groups especially can be a barrier to those very individuals in your environment. So be aware of your power, your privilege, and where you come from. Also, be critically self-reflexive about power and privilege, again, in ongoing ways. Challenge stereotypes and essentialized constructs of, make sure that you're constructs of ourselves and others, especially, again, equity deserving groups in these aspects. Being a transformative leader as well is about being willing to critically assess our biases, our assumptions, our expectations, our intentions, and impacts of our choice and how they may unintentionally and negatively impact others within our environment. It's about being conscious of our strengths and our weaknesses and seeing support when matters fall out of our expertise. Decolonize your leadership. Forget hierarchies. Understand that there may be individuals in your environment who don't have a title or who may be lower in the hierarchy within your organizational governance structure that may have something to contribute to help your leadership. Be humble and empathetic in how you are willing to take on feedback and contributions, especially from those who are from underrepresented groups. Understand that they've never been given opportunities to even be in those spaces that you are at, but yet they may have really good information that can contribute to decision-making processes, especially when considering EDI. Right? Being a transformative leader as well is about knowing and expressing our agendas and our non-negotiables. It's about supporting critical conversations, including conversations about privilege, race, colonialism, and sexism, and many aspects of EDI in this way. And it's about intervening when conversations become unsafe or assumptions need to be troubled. You know, being a leader for equity is about bringing the outgroup in. Understanding opportunities for advocacy where you are at. It's about having a vision for EDI as well, including that lens within the way in which you think about, you know, what your 2-year plan, your 5-year plan, or your governance structure is for where you are at and where you find yourself. It's about, you know, creating a constructive climate as well, right? Building individuals and valuing individuals where they're at. And it's about being able to build cohesiveness within the team, regardless of people's identities, you know, gender expressions, religion, backgrounds in this way. And then understand, I leave you with this last, point here, you know, our identities matter. Sandler and Chavez state here that identity manifests in the way that we lead, supervise, make decisions, persuade, form relationships, and negotiate the myriad of responsibilities faced each day. As individual leaders, we practice within norms, assumptions, values, beliefs, and behaviors originated in our multiple identities. Leaders really need to think critically about who they are, how they define good leadership. You need to be reflexive about what your intersectional identities are within the existing systems of power as well. So gender, ability, sexuality, race, ethnicity, religion, and colonialism, and how you're able to navigate your world. Where do you think you have, you know, blind spots that may interfere with your ability to understand these certain issues? And then, you know, have any of these identities and blind spots ever played out in your leadership practices? So how you understand the problems that come up and how you sort of strategize for solutions in this way. So thank you. And I'll take questions now.
Thank you so much, Nicole. I really appreciate all of your insight, and I do welcome everybody to enter your questions in the Q&A panel. I am seeing a few comments and questions that have come in. Michelle says, we have a long way to go, and asks, how do we start?
That's a really good question. And I think, you know, as I look at it from a structural perspective, it starts with the self. It's about self-evaluation and self-reflection. But then it is as well about finding those opportunities that you can advocate, whether it be in the small spaces. It starts in a small place, like a meeting. When you see an individual in a space speak over someone, and you kind of see, and you kind of identify that it may be also oftentimes because of an individual's identity that they are speaking over them. So racism within a meeting or sexism within a meeting, when someone makes a comment like that, address it. You know, if you have the opportunity to address it, address it. Don't just let it go. Because this is why oftentimes in these environments, you know, these things have been allowed to go on for so long, because nobody confronts it. I think it starts where you are at and where you are able to. So using the power and privilege that you have in the spaces that you've been given, how do you advocate? Ask yourself, how do you promote those from underrepresented groups in those spaces? What opportunities have you given others in that way? And how have you advocated in the space where you are at and in the influence that you have?
Thank you. And Diane makes a comment that's along the same line, saying we need to be willing to hear others' stories and their experiences in the workplace, et cetera. all these environments without any fear of reprisals. So yeah, creating that safety.
Absolutely. It's about a willingness to be called in. That's, one key aspect of a leader and leading for equity. I think actually, thank you, Diane, for that too, because I actually think that's the biggest quality, is the ability to be called in. It's the ability that when someone criticizes you about your leadership or something that you've done, is the ability to say, I'm sorry, I didn't realize how my actions, my words may have hurt someone, but I'm willing to do better. Let's talk this through. Let's talk about how I can do better. Or, let me examine that and let me reflect on that and find ways that I can do better, and a willingness to do better in that way. Because I oftentimes too, like I said, I find even within these spaces, I myself, and especially with students and trainees, I love doing sessions with students actually, because I learn so much from them. They have so much to offer in this way. But I've been called in too, after workshops and after sessions. If you see that circle, the circle with the, the outside aspects of people's identity and the insides, I can't tell you how often that has changed for me, because I've had a student, schedule a meeting with me after a session and say, Nicole, I just want to talk to you about how, I don't think this word is appropriate using it in that wheel. Or Nicole, I was wondering if we can have a discussion on why you're using this term in this way, or why you're using this aspect of identity. And I've been challenged in that way, and I've had to, really kind of take that in and reflect on it myself as well. And it's that willingness to be called in. One of the things too, and even for me, and I, like I said, I speak to a lot of my own personal experience. One thing I really want to say to individuals as well, I have a leadership role at an institution. I love the work that I do. I love the people I get to work with, but I do work with people who look at me and aren't able to collaborate with me because they've never worked with a Black person in a leadership role. And so the microaggressions that I still experience on a daily basis in this work as a leader is hurtful and really harmful. And I have to take it, I have to navigate around it, I have to work around it on a daily basis. Understand how, especially too, when you're working with individuals from underrepresented groups, how you may not realize that your biases or your inability to understand and see an individual who is Black, Indigenous, a person with a disability, or even a woman in a leadership role that you have to collaborate with and work with, who may have expertise that you need to lean into, that you may not have an ability to collaborate with them, and that it might be an issue that you have. Reflect on that, on how your comment may be rooted in that, how, a slight or a snub or an undermining in that environment may be because of that. I think that this is oftentimes too where leaders need to understand, and especially those who are from dominant groups who have never had to consider other individuals who don't look like them in these spaces, need to understand it's going to be a learning experience. You have to sit with that discomfort. You have to be willing to take on that discomfort as well, and that criticism, and you need to be able to be willing to do better in that space.
Thank you, Nicole. And it is getting to be, it's actually a little bit after 1. I wish we could stay all day and take questions, but if you do have time to take a couple more questions, I don't mind going a little over. Depends on, obviously I want to be respectful of your time.
Yes, I have a couple minutes. I'm happy to stay on for a couple more.
Wonderful. So one of the questions that's come in is someone asking about resources available to do some EDI training as a level set. I would recommend the cultural safety training that's available from the Indigenous Primary Healthcare Council if you're looking at EDI related to indigeneity and decolonizing your work and creating culturally safe environments. And I also know that Rainbow Health Ontario has some excellent training for EDI related to sexuality and gender identity. But Nicole, do you have other resources that you would recommend for EDI training?
Yes, and I think too, I'd say start with your organization and see what your organization has to offer. But a lot of other organizations, especially too, who are similar to your organization, may also offer sort of free on their websites, modules or training modules. And you know what? Even in my work, for me, what has been one of my best friends is YouTube. I have found a lot of free resources as well on specific topics, like when you're struggling with a question, to YouTube it. And there are amazing experts who have done TED Talks, like, even looking at, oh my gosh, if you haven't yet, please access Kimberly Crenshaw's TED Talk on intersectionality. Brilliant. Like, she explains it in such an amazing way. Like, I use that TED Talk of hers to explain intersectionality in my work and in my workshops a lot. But, going to those kinds of experts as well, learning from them. Again, in your field, in your area, there are experts, and these individuals have been sharing their knowledge for so long. I know to even Indigenous scholars, there's so much work on indigenizing and thinking about decolonization frameworks within healthcare and healthcare systems. Access those resources, they are available. So, I start with a simple Google of the terms and find those experts. Like I said, YouTube even, but also going to your organization or similar organizations like yours, they may have those. Yeah.
It's fantastic. Thank you so much, Nicole. I think we will wrap up here because it's getting to be close to 10 after 1, but I want to thank you again for taking the time to speak with us today, share your insights, your experience, your personal story. We have recorded this webinar. We will be sharing the recording along with the slide deck to everyone who registered for it. So that will be posted on the POPLAR website within the next few days. Watch your inboxes for an email which will include links to those resources, along with maybe some of the other resources that were mentioned during the webinar. And we'll also include links to the POPLAR network and CIPSN for those who are interested in joining or getting involved or want to know more about these networks. So thanks to Cliff, to Nicole, to the POPLAR network for organizing this series, and to everybody who registered, made the time to be here today for this important learning. I wish everybody a wonderful rest of the week.